Diabetes is a very common medical condition, yet many people still don't fully understand it. Today on the Diabetes Wellness Hub, we're sharing this video to help you grasp the most essential facts about diabetes, so you know how to manage it and prevent complications. 1. Diabetes is a metabolic disorder. Diabetes is a disorder of metabolism. It occurs when the body has trouble processing glucose, sugar, especially during fasting or after eating. Normally, after eating, blood sugar rises, and during fasting, it drops. There are two common types of blood sugar tests. Fasting glucose test, after at least 8 hours without food. Random glucose tests taken at any time, regardless of meals. If your random glucose level is above 11 millimoles per liter, you may be diagnosed with diabetes. For the fasting test, if your blood sugar is above 7 millimoles per liter, it also suggests diabetes. But the test should be repeated to confirm the diagnosis, as many factors can affect your fasting levels. 2. What is pre-diabetes? Pre-diabetes is not yet diabetes, but it's a warning sign. It's a condition where your blood sugar is higher than normal, but not high enough to be classified as diabetes. Normal fasting glucose, below 5.6 millimoles per liter. Diabetes above 7 millimoles per liter. Pre-diabetes 5.6 to 6.9 millimoles per liter, fasting, or 7.8 to 11 millimoles per liter, random. Or HbA1c test, 5.7 to 6.4%. Pre-diabetes means your body is at a tipping point. It's a wake-up call to change your lifestyle immediately, through better diet, exercise, and weight control, so you can reverse it. Not everyone with pre-diabetes progresses to full-blown diabetes if action is taken early. 3. Symptoms of diabetes. While pre-diabetes often has no symptoms, full diabetes may show some very distinct signs, often referred to as the 4 big ones: increased hunger, increased thirst, frequent urination, unexplained weight loss. Why? Because sugar, glucose, is the main source of energy for your body's cells. In diabetes, insulin is either not produced or doesn't work properly, so glucose can't enter the cells. This leaves the cells starved for energy, prompting your brain to signal hunger, causing you to eat more. Yet since glucose still doesn't reach the cells, you lose weight. Excess sugar in the blood also leads to more urination, as the body tries to flush it out. This in turn causes dehydration and increased thirst. In some cases, ants may even gather around your urine due to the sugar content, a sign of glycosuria. 4th, gender-specific symptoms. Men may experience erectile dysfunction. Women may suffer from frequent vaginal infections, including yeast infections. Additionally, in severe cases, when blood flow to peripheral areas is reduced, nerve endings become damaged, especially in the hands and feet. This can cause numbness or tingling, and people may not feel pain, like if a rat bites their foot during sleep, they may not notice. This can lead to chronic wounds or ulcers, especially in pressure areas, which is why diabetic foot ulcers are common. 5. Vision problems. Diabetes can also damage the blood vessels in your eyes, particularly in the retina, diabetic retinopathy, causing blurred vision. If untreated, it can lead to partial or even total blindness. 6. The importance of early detection and lifestyle change. Many people ignore early symptoms or delay testing. But the truth is, early detection through proper testing, fasting glucose, random glucose, HbA1c, and immediate lifestyle adjustments can prevent or slow down the progression of diabetes. This includes cutting down sugar and refined carbs, increasing physical activity, maintaining a healthy weight, getting regular checkups. At Diabetes Wellness Hub, we aim to provide easy-to-understand science-backed education to help you take control of your health. If you found this helpful, subscribe to our channel for more videos like this. Stay informed, stay healthy. Diabetes can be a silent threat. If left unmonitored or poorly controlled, it may lead to serious emergencies like diabetic ketoacidosis or hyperosmolar hyperglycemic state, both of which can result in coma or even death. These are critical conditions that require immediate medical attention. Another emergency that can occur, especially in those already diagnosed with diabetes and undergoing treatment, is hypoglycemia or low blood sugar. This typically happens if a person takes too much medication or insulin. Overdosing can suddenly drop the blood sugar level to dangerous levels. These are key symptoms and scenarios every diabetic patient should be aware of. In this video, we focus mainly on type 2 diabetes, which accounts for 90 to 95% of all diabetes cases. While there's also type 1 diabetes and gestational diabetes, we'll leave those for another time. 4. What causes type 2 diabetes? There are two major causes. Genetics. A family history of diabetes increases risk. Lifestyle factors. Diet, exercise, and weight management play a major role. Let's break this down. Imagine your body needs about 10 grams of sugar a day to fuel its cells. If you eat 10 grams and exercise enough to burn 10 grams, everything stays balanced. But what if you eat 20 grams of sugar and only burn 5 grams? That excess sugar stays in your bloodstream. Over time, insulin receptors on your cells, which act like locks, get overwhelmed and stop responding. This is called insulin resistance. Insulin, the key, keeps trying to unlock these now damaged locks, receptors, to let sugar into your cells but fails. The pancreas tries to compensate by producing even more insulin, overworking the beta cells of the pancreas. Eventually, these cells become damaged and insulin production drops, resulting in full-blown type 2 diabetes. This breakdown in the lock and key system is why high sugar diets and low activity levels are major risk factors. 5. How is type 2 diabetes treated? Treatment focuses on improving insulin sensitivity, reducing blood sugar levels, supporting the pancreas. There are different medication groups. Medications that help cells respond better to insulin. Medications that slow down sugar absorption from the gut. Medications that help the kidneys excrete excess sugar. Medications that stimulate the pancreas to produce more insulin. Treatment plans are personalized depending on the patient's condition, and lifestyle changes remain the cornerstone of therapy. 6. How to prevent type 2 diabetes. This is the most important takeaway. Prevention starts with tackling the root causes, regular exercise, at least 30 minutes a day of walking, jogging, or moderate physical activity. Weight loss. Especially for those who are overweight or obese, losing just 5 to 10% of your body weight can dramatically reduce risk. Healthy diet. Avoid foods that contribute to obesity and insulin resistance. Be cautious with refined carbs and sugar, trans fats, and processed foods. Instead, focus on foods with a low glycemic index, GI. What's GI and why it matters? The glycemic index, GI, measures how quickly a food raises your blood sugar. High GI, above 70, e.g. sugary drinks, white bread. Medium GI, 50 to 70. Low GI, below 50, e.g. sweet potatoes, legumes. Let's compare. Drinking a sugar-sweetened beverage causes a rapid spike in blood glucose, followed by a crash, making you feel hungry again quickly. Eating a low GI food like boiled sweet potatoes causes a slower, steadier rise, avoiding sugar spikes and crashes. You can Google GI index chart to find the GI of common foods and make better choices. Try to split your meals into smaller portions throughout the day to prevent post-meal sugar spikes. Final thoughts. So those are the 6 key things everyone should know about diabetes. We hope this video helps you understand the disease better and equips you with the tools to prevent or manage it effectively. If you've made it this far, leave us a comment saying, "I watched till the end." Don't forget to subscribe to Diabetes Wellness Hub by clicking the circle in the middle of the screen. You can also check out more videos on the left and right side of the screen. See you in the next video. Stay healthy. Diabetes Wellness Hub.